If you want to know if a stroke patient in ICU can survive on a ventilator, stay tuned. I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com. And I have another quick tip for families in intensive care. Today, I answer a question that we get quite frequently. And the question today is, can a stroke patient in intensive care survive on a ventilator? Now, I've asked ChatGPT, and we'll answer what ChatGPT says. But I also need to say that I have my own opinion, because I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very confidently say that we have saved many lives for our clients in intensive care. And you can verify that if you go to our testimonial section at intensivecarehotline.com, or if you go to our intensivecarehotline.com podcast section, where we've done client interviews, and they can verify, they will verify that we saved their loved ones' lives. Now, let's go to our question today. Can a stroke patient in ICU or in intensive care survive on a ventilator? So here's what ChatGPT says. And I think the answer is very incomplete, but I will add on to it. So ChatGPT says, is a stroke patient in ICU can survive on a ventilator, depending on the severity of a stroke and the patient's overall condition. A ventilator is used to assist or control breathing when the patient's respiratory function is compromised. For stroke patients, this may be necessary if the stroke affects areas of the brain that control breathing or swallowing, or if the patient is unable to maintain adequate oxygen levels on their own. In the ICU, the focus is on stabilizing the patient, addressing any immediate complications such as difficulties breathing or airway obstruction, and providing supportive care. The length of time a stroke patient remains on a ventilator depends on the specific circumstances of the stroke, the patient's recovery progress, and whether they can regain independent breathing ability. However, long-term reliance on a ventilator may indicate a poor prognosis, and decisions about weaning off the ventilator are usually made as the patient's condition improves or worsens in collaboration with the medical team. That's what ChatGPT says. Now, I think this is a very incomplete answer. It's a very incomplete answer. So let's break this down further. I agree with some of the things that are being said here, and some of it is dependent whether a patient can regain independent breathing ability, but some of it is not dependent on whether a patient can regain independent breathing ability. So, for example, if a patient can't be weaned off the ventilator after a stroke with a breathing tube, they could have a tracheostomy. So I'm surprised that ChatGPT is not even mentioning a tracheostomy. I'm wondering, does ChatGPT even know what a tracheostomy is? Right? So, and long-term reliance on a ventilator may or may not indicate a poor prognosis. But, the question is, what is the patient's goal? At no point in time is ChatGPT talking about what is a patient's goal. What's their family's goal? Right? At no point in time is ChatGPT allowing the individuality of a patient or a family to take its place. Right? What if the family or the patient wants a tracheostomy and wants to go home with services like intensive care at home? And you can find more information at intensivecareathome.com. Right? And what is a poor prognosis? It's a perception. Right? It's a perception. It may be a poor prognosis. It may not. The patient might improve. They may not. Right? It also says, decisions about weaning off the ventilator are usually made as the patient's condition improves or worsens in collaboration with the medical team. What about in collaboration with a patient or a family? What about that? Who would have guessed? Right? And just because I talk from experience, we have a number of clients in the community with intensive care at home that are on ventilators with tracheostomies that had strokes or had other significant neurological conditions, and they actually want to live. They do want to live, right? So, at no point is ChatGPT individualizing or acknowledging the patients or the families, which is disappointing. So ChatGPT has to take more human elements into their answer, right? So, also keep in mind that approximately 90% of intensive care patients survive. That's 9-0 or 9 out of 10. Now here's another tip. I actually looked up on Google, what's the mortality rate in patients with ischemic stroke who needed mechanical ventilation? So the mortality, or 1-year mortality, is around 55%. It's approximately 50% that needed mechanical ventilation. With an ischemic stroke was 55%. So there's a large number of patients also dying, but the question is, did they end up with a tracheostomy, for example? Right? So it's also an incomplete study, I believe. Right? And again, what if patients lived for 9 months, but they wanted to live and they had a good quality of life? This is about quality of life. It's not about what people think. And quality of life is a perception. It's an individual's perception of what is a good quality of life or what isn't. Right? So I hope that helps you understand. And like I said, you may want to have a look at intensivecareathome.com, where we help families in intensive care, patients and families in intensive care, to continue care and treatment at home in the comfort of their own home. We're sending our critical care nurses into the home with intensive care at home to keep our clients safe at home and provide a genuine alternative to a long-term stay in intensive care. Right? And that's why we helped hundreds and hundreds of members and clients over the years to improve their lives instantly, making sure they have peace of mind, control, power, and influence, so that can make informed decisions, so that their critically ill loved ones gets best care and treatment always. Right? And that's also why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, making sure you make informed decisions, have peace of mind, control, power, and influence, so that your critically loved one gets best care and treatment always. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. And when I talk to doctors and nurses directly, I ask them all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time, so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.